Okay, we'll just give it one more minute here, and then we'll welcome everyone.
1 o'clock on my end.
1 o'clock on the dot. All right, let's just dive in. So we have
Sure.
time. Hi, everyone watching. Thanks so much for joining us today. My name is Katie Osler, and I am the Communications Director here at Conceive Health. And I'll be hanging out in the background here helping to provide tech support and moderate today's Facebook Live. So first of all, thank you so much for joining us here today safely from your homes. And thank you so much to the team at Trio Fertility for allowing us to share this information with you. And we hope you'll find it really helpful. So I'm now going to introduce you to Dr. Jennifer Fitzgerald and Dr. Tracy Malone, and they are fertility naturopaths and the founders of Conceive Health. And so for those of you who are just meeting us for the first time, Conceive Health is a naturopathic practice that focuses on fertility and works hand in hand with Trio Fertility doctors. So we all know that the last few months or weeks have been especially stressful, and some of you may have had fertility treatments postponed or canceled. So Dr. Malone and Dr. Fitzgerald are going to talk to us today about what you can do to optimize your fertility from home, so then the odds are in your favor when it's time to resume your fertility treatment. So Jen and Tracy, over to you.
Thanks, Katie.
Hi, everybody. So today we're going to talk about the 100 days of preconception. So, this is obviously a very interesting time we're living in. If you are a fertility patient, then potentially maybe you have just started out, maybe you are in the testing phase, maybe you were partway through some treatment and had your cycle postponed. So, everybody's kind of in a different situation, but at the same time, we're all in the same situation because we're all now waiting. So, what we're going to do is we're going to sort of talk about how we can use this next few weeks, or the past few weeks even, to our advantage in terms of improving our options and our fertility outcomes. So we can go ahead to the next one there, Katie. So, like I just said, we're all kind of in this sort of time standing still in one way, in terms of we're all home waiting and we can't proceed with treatments or testing, but time is not in fact standing still. The clock is still ticking. And in this period of time, the eggs and sperm that you'll potentially create your future child with are maturing. And so, right now, if you look at what's happening in our world, humans are home, and what's happening in nature, the nature is starting to come alive again, right? We're seeing, animals invading cities. We're seeing, new plant growth happening, things like that. So whereas we're, thinking that this is this major trauma to us, they're kind of rejoicing right now and really appreciating that. And I think we can learn something from that and take a step back and maybe, implement some of our innate strategies, dietary strategies, exercise strategies, supplement strategies to improve our fertility. Okay, so when we talk about preconception and the 100 days, what we're talking about is basically a 3-month period of time prior to conception, where we have an opportunity to improve the quality of both egg and sperm. And so we all know from a female perspective that we're born with so many eggs and we don't make any more, but we can influence the quality of those eggs. And so that is going to take place in the 100 days prior to conception, prior to ovulation. And the same with the sperm. So sperm, men actually regenerate every approximately 116 days. So unlike eggs that are kind of with us for the long haul, we're actually getting brand new crops of sperm about every 3 months. So both of those types of cells, both egg and sperm, are very vulnerable and sensitive to the current environment. So that might be from a nutritional perspective, a toxin perspective, a stress perspective. So we'll talk about ways that we can maximize the potential of some of those things. So this slide shows us a picture of follicle development from an egg perspective. So 100 days of egg optimization. So we can see a tiny little egg way over there on the left side of the screen, our primordial follicles. And so approximately 100 days before conception, that egg or follicle is activated. And at the time of activation, we have this genetic blueprint that will become the future child that is set in stone. So the genes and the DNA that we're going to use to create that embryo are going to be set at that time. So we're going to take about 100 to 90 days from now until ovulation. So what's happening in that period of time? The egg is actually going through this process where it's replicating and making these little engines, for example, called mitochondria, and they are banking energy. So the whole purpose of this 100-day period for this egg cell is to create as much energy as possible. So an egg requires a lot of energy and be able to create a human at the end of fertilization. So this is the opportunity where it's banking as much energy as possible. So in order to do that, it has to have the proper tools in the bank, and it has to have basically the gas that it needs to run the engines. So this is where things like antioxidants, dietary vitamins and nutrients, minerals, all of those things will come into play at various stages here. So we hear about prenatal nutrients like folic acid often. We know why we're taking that. This is going a little bit beyond folic acid, and this is what we call our fertility pharmacy. So we'll move on and talk about that now. So the female fertility pharmacy, it can encase a whole bunch of different vitamins, nutrients, antioxidants, and things like that. So this just demonstrates a variety of different things that you might consider to use to support egg quality and female fertility. It's important to note that not every female will need all of these specific nutrients, but what this shows is a representation of different things that might be used at different phases. So we discussed folic acid momentarily in terms of its use for neural tube defect, prevention of spina bifida. We hear about it in prevention of things like Down syndrome, but it's also used for things like DNA and RNA replication. So not just beyond, kind of the traditional prenatal vitamin there, we have to consider the other agents as well. Coenzyme Q10 is probably one of the most popular fertility supplements that patients talk about beyond folate. And so that is one of the examples of an antioxidant that we would use for egg quality. So it is an example of something that might help to increase the amount of energy that that egg cell is creating in order to improve the overall egg quality. So when we're considering other types of these nutrients, we might be looking at, specific blood levels. So for example, if we're vitamin D deficient, you might need more vitamin D. If you're prone to specific underlying conditions, you might be in need of another nutrient, for example. So this is where sometimes consulting with a professional that knows a little bit about nutrition and egg quality can be beneficial. I'm now going to turn it over to Dr. Malone, and she's going to talk a little bit about sperm with us today.
Hi, everyone. Thanks for joining us today. I'm going to talk a little bit about male factor fertility. I think this is a really important topic to sort of pause on and consider. I see lots of patients in our clinic, the majority of which I think are female. And, it always puzzles me because the male side of fertility is literally half the DNA. And so sometimes when I talk to patients and talk to their partners and suggest that they potentially take a male prenatal, they look at me like I'm from outer space. But, research does show that most of our, reproductive age men that aren't taking a multivitamin or prenatal are traditionally fairly low in key nutrients like folate, zinc, selenium that are required for spermatogenesis. If you look at the WHO's most recent report on male fertility, they're actually identifying male fertility as an epidemic because the last meta-analysis that was released in the fall, I believe, of 2018 showed that globally we have had a decline in both semen concentration and quality of about 50% over the last 50 years. So I always try to point out that this issue is common, and And as Jen said, or Dr. Fitzgerald said earlier, I think the key take home for male fertility is that we can do a great number of things to change the outcome here. Unlike women, men turn over their entire population of sperm every 100 days. And so we literally get a new sort of kick at the can, if you will, every 100 days. And so preconception can be exquisitely important for male factor fertility, which is the cause of infertility at least half of the time. So this slide represents, similarly to follicular genesis, this is called spermatogenesis. And this is just a diagram that represents the window of time that we have to improve the sperm, both count, concentration, and motility. So as we said, it takes about 116 days for sperm to go from a primordial cell that you see on the left-hand side of your screen all the way to mature spermatozoa on the right-hand side. So in this 100-day window, you know, what our guys are eating, drinking, not smoking, you know, things like that, including sleep and nutrition and exercise. All of these can have a great influence on the environment in which these sperm develop. Now, if you consider that a spermatid is the smallest cell in the human body, these guys and girls, because they are the defining, I would say, decision makers on what sex the baby will be, the sperm really are very vulnerable to their environment. And we need to pay close attention to what types of nutrients and environmental insults are happening during this 100 days of maturation. The other thing I like to point out to the patients is that, you know, when you have a semen analysis done, it is like a window into the man's overall health. So in this tiny little analysis, we can get actually a very good predictive value of that man's overall and future health potential. So I think that it's exquisitely important that we pay attention to this and not just write off an abnormal semen analysis and say, oh, well, it doesn't matter, we can do IVF. Do you want to bring the best of a poor, cohort to the table? Or do you want to bring the best and healthiest sperm of a healthy cohort to the table when you arrive at IVF? That's the big question. And so if we see an abnormal, an anomaly in a semen analysis, it definitely warrants future investigations into that man's overall hormonal health, nutritional status, and oxidative stress parameters. This is what we would call the male fertility pharmacy. So, you know, it's interesting. If we have low, counts or low motility, we can't just give a drug or a hormone and have that correct. Sperm are exquisitely nutrient dependent. And as I stated earlier, a lot of our men are nutrient deficient based on the standard American diet that we tend to consume, and we call that the SAD diet because it makes us so sad. So when we look at the male fertility pharmacy, it is more than just folate as well. Folate is in here and B12 is in here. These are critical for RNA and DNA synthesis. But then we're also looking at things like zinc and selenium, which are trace minerals that are found in our environment in trace amounts. And if we don't have a good variety of food and we are not eating the foods that contain those in concentration, then the majority of our men are low in those trace nutrients. So it's important to choose a prenatal for a man that actually has good quality amounts of these. So, zinc, you'd be looking for about 200 micrograms and, selenium, 200 micrograms, and zinc about 50 milligrams. And then there's some other vitamins, these would be things that I would call antioxidants. And so this would be under this umbrella term of, nutrients and cofactors that reduce oxidative stress and can improve the environment in which the sperm develop. And at the end of the I often get the question, what is the right prenatal for my partner or for me? And that takes a bit of a case review, because if a man has a normal semen analysis, I'm going to give him, the basics. If a man has reduced count or motility, I'm going to give him a higher concentration of antioxidants. And at the end of the 100 days, we'll see that ameliorate in most cases. So I do think that it's case dependent and lifestyle dependent. And this is why lifestyle matters. So, you're given a genetic deck of cards, if you will, and that's your DNA, and that you can't change. That's the hand that you've been dealt. And so the things that you can look at are your behavior, your behavioral patterns. And so, I always say to my patients that your choices influence change. So you choose your behavior patterns, your dietary patterns, your exercise patterns. And, research demonstrates that both diet and exercise, in their own right, can improve all parameters of the semen analysis. So, if we can do both, then we're going to be way ahead of the game. And by making choices in diet, exercise, supplementation, and social toxins, you can absolutely change the third part here, which is the environment in which the sperm develops. And that's really what we're after here. And you can control this, right? And so this is where we're trying to empower patients to make correct and good choices while we're at home, so you're ready to go when the clinic reopens. So just a little note on diet. Anyone who walks into my office, one of the first questions is, after what supplements can I take, is what can I eat to improve my fertility outcomes? And so I would say that, as a general rule, a Mediterranean diet is good for everybody. And then if you want to get more specific, I would say that the correct dietary routine for a particular patient really depends on their case history and potentially the pathology that we're dealing with. And for sure, there are different dietary recommendations for different pathologies. So somebody who has, say, endometriosis, I'm going to talk to them about a plant-based diet, that's high in cruciferous vegetables, and we're going to be working on estrogen detoxification and their microbiome. Versus somebody who has PCOS, I'm going to be talking about how can we control insulin levels and improve your muscle mass, and what type of carbohydrates should we be taking in relationship to what amounts of protein to keep your glucose stable. So I would say that there are different dietary platforms for different conditions, but overall, we're talking about eating a whole food, high plant-based diet with adequate protein, and a decrease in processed foods and refined carbohydrates. So all the plants, basically. Any tips for that, Fitzgerald? You want to add anything into that?
I don't think so. I mean, I think just going back to a lot of the questions that I get regarding diet, what's the best type of diet? Should I do paleo? Should I do intermittent fasting? Should I do keto? Any of those types of things. And I think every diet is valid at if it's the right time and the place for that specific diet. So for example, in endometriosis patients, like Dr. Malone mentioned, I might recommend that patient go gluten-free. There's some evidence about gluten aggravating endometriosis. So a Mediterranean diet might not be the best one. You might be leaning more into paleo in that specific aspect. Or for example, if weight loss is a component of any of those diets, maybe we're going to pair that with something like intermittent fasting. So really, I think just to highlight, not all diets are the same, and not every person is going to benefit from each diet. So it's individual. And really, at the end of the day, the one that you can stick to is probably the one that's going to be the best.
Absolutely. I think, what I would like to add to that is that there's a lot of information on the internet right now about different types of diets and, paleo versus keto versus vegan or vegetarian. And I think they all have strengths in their own right. But as Jennifer said, timing is everything. And so, you know, if I have a patient that needs to lose a significant amount of weight, yeah, we're going to probably lean into a ketogenic diet for a period of time, as long as we have a long enough runway to do that. But am I going to instruct a patient who's going to do IVF next month to start a ketogenic diet? Absolutely not, because that's a stressor on your metabolism that won't really serve your follicle growth well. It's like plan B for our sort of energy metabolism. But there is a time and a place for keto, you know, in a PCO patient who is anovulatory, and we have a long runway of time to help her to achieve the hormonal balance that she's looking for. We might look into that, but you know, it's not something that I would jump into wholeheartedly right before an IVF cycle.
That's right. Yeah.
There's a lot of other lifestyle factors that matter. Sleep is one that I will come back to over and over and over again. My generation, you know, I'm in my early 40s. We don't sleep very well. I don't think we've prioritized sleep very well for a long period of time. We've unprioritized sleep and glorified busy. Right. And so,
and then there's the screens too, right? The screens before bed, everybody's on their iPhone all day, and in the evening, TV's on or at night, especially right now with all the news happening in the world.
Right. Yeah.
So I think it's interesting because right now we're home and realistically could be sleeping more, some of us at least.
Yeah.
And are you or aren't you? You know, are you anxious and stressed and you can't get good sleep, or are you relaxed and you are able to get good restful sleep? And I think that's telling as well.
Yeah. And you know, there was a wise woman that once told me that that we really need to try to be sleeping between the hours of 10 and 2. Ooh, I kind of sound like Darth Vader there. Can you guys hear that? Anyways, the timing of the sleep matters. And so the earlier you can get yourself into bed and set that circadian rhythm, the better off it's going to be for your sleep quality and the depth of sleep you get into. Melatonin is actually it's a hormone that we produce on our own during quality sleep-wake cycles. And melatonin has been shown time and time again to actually improve egg quality. And so a lot of people will say, I sleep fine, I get enough hours. And I would say take the melatonin anyway, because I'm giving it to you for your egg quality, not necessarily for your sleep patterns.
Yeah, there's also some evidence in frozen embryo transfer cycles for melatonin and implantation support. So if you're preparing for a frozen embryo transfer cycle, it still can be beneficial as well. And yeah, I don't necessarily gauge sleep as the necessity to use it. So they can probably benefit from a little bit of melatonin, but always best to check first before you start taking it. Yeah. And also consider going to bed a little bit earlier, I think, is a thing that we kind of overlook, but actually the number of hours that you sleep before midnight will count as 2 hours. So, you know, trying to get to bed a little bit early is more beneficial. Sleep is our best antioxidant.
Yeah, best antioxidant on the market is a good night's sleep, for sure. Exercise, though, you know, I was an athlete in a former life, but now I'm understanding the importance of exercise, you know, as I move into my middle life. And you know, if there's one thing that we know about mitochondria, one way to turn them on and improve their replication is through exercise, hands down. So particularly, you know, resistance training. So weight bearing exercise will sort of break the muscle fiber and cause it to repair. And this sequence of events has impact on your genes and basically how your DNA replicates and turns over. So one of the fastest ways to increase your mitochondrial function is to do some resistance training, for sure.
Right. Toxins can come from a wide variety of different sources. There's what we call the social toxins. So think things like caffeine, alcohol, cigarettes, marijuana, those types of things. So really, I mean, I think we all know that we should be reducing or eliminating all of these things from our lifestyle, especially when we're preconception. We know that we shouldn't do any of them while we're pregnant, so probably not a great idea to give them to your eggs as well. But most people want numbers when we're dealing with these types of things. So to give you realistic numbers in terms of caffeine, my rule is usually one and done. So if you need that coffee, have one coffee and call it a day.
Yeah.
Or one caffeinated beverage, whatever that should look like for you. And then if you need something else for the rest of the day, consider herbal teas, water. You need water. That's what your body actually requires. So if you're struggling, drink some water and then see how you feel. For alcohol, you know, in a perfect world, obviously, if we're trying to conceive, we don't want to have any alcohol. But realistically, we can drink up to 4 drinks per week without seeing any type of cellular change in terms of the egg and sperm cells. And then between 4 and 7 drinks, it starts to get a little hazy. So we do see some hormonal output changes. And then beyond 7 weeks, we see a definitive change in fertility. So, you know, my rule of thumb is to keep it under 4 if you can, but definitely keep it under 7.
Yeah. And, you know, our generation likes to binge drink. So we don't have like 1 or 2 a night. We save it all for Saturday. And so that can be a real trip on your metabolism. And, you know, I was reading a paper a while ago that showed that alcohol directly inhibits your mitochondria's ability to produce NAD, which is our primary currency for energy. So you know how you feel sick and tired the next day after you've had too many cocktails? It's because your body's out of gas, basically. So if you think you feel like that, imagine how your eggs feel, right? So realistically, I know I'm not anyone's favorite person when I ask them to, you know, downregulate all their social, you know, fun stuff for a period of time, but recognize it is just for a compressed period of time. And you're going to give yourself the best shot by removing those from your system because they're oxidative stressors. So if I'm treating you for presumed oxidative stress with antioxidants, and then you're going and using substances that causes oxidative stress, you know, it can cause, you know, a bit of an imbalance. And I would also say that, you know, some people's, you know, genetic fingerprint can handle more of the social toxins than maybe their neighbors can. And so we're not all the same. We all have different detoxification capacities. And so I have seen in some cases that he or she is doing everything right. The particular case I'm thinking of is a male. And the minute he started to reintroduce alcohol in just a small amount, we saw the sperm plummet again, right? And so people that are susceptible to detoxification anomalies can potentially see a higher risk of this affecting them than others.
Stress, what do we want to say about stress? We're in the middle of a pandemic, so everybody's kind of stressed out right now.
These days, yeah.
So there's more, I mean, obviously everybody's waiting right now. I think waiting is a huge part of stress for, you know, fertility for sure. It's always seemed to be waiting for something, including the clinic to reopen right now. So, I mean, all we can really say about stress is, you know, if stress prevented pregnancies, probably none of us would be here, right? Everybody's had stress in their life.
Exactly.
However, we know it doesn't help, and it doesn't help with hormone output. It doesn't help having a good libido even, right? Like who's in the mood when they're crazy stressed and can't sleep and are anxious all the time. So taking some time right now to kind of de-stress. There's lots of different options out there. Get some extra sleep, have a bubble bath, meditate, journal, do some yoga. There's lots of online yoga right now. Go for a run.
Yeah. I always say to my patients, define stress, right? So there's stress, there's like mental, emotional stress, and then there's stress as in there's physical stress. I'm not getting enough sleep. I'm not feeding myself properly. And then there's, you know, mental, emotional stress, like my boss is yelling at me, or, you know, I'm watching my watch as the clinic is closed and I feel panicky due to timelines. So I think sometimes it's really important to focus on the pieces of stress that you can control, like Jen said. So, you know, sleep-wake cycles and make sure they're routine. ensuring that you're getting your 10,000 steps every day. Just get out there and move. I don't care if you walk, run, bike, you know, do the running man, whatever it takes to get there. Get your 10,000 steps. And then, you know, keep a routine with food and water, like feed yourself at regular intervals and the right things. And, you know, these are ways that we can down regulate sort of physiological stressors, even if the mental ones are still there.
Yeah, just basic self-care.
Yeah.
Eat, sleep, drink, water specifically.
Water.
Yeah.
Not too many martinis.
Not too many. Okay, so moving on here, this gives us a bit of a fertility diet checklist. So this kind of breaks it down into, you know, what we should be eating as opposed to just eating food. So good quality proteins, lean proteins, including lean meats, fish, eggs, legumes, things like that, whole grains. And from a carbohydrate perspective, we're sticking to complex carbohydrates. If you're going to have grains, they should be whole grains. Get your carbs from fruits and vegetables, leafy greens, root vegetables. Healthy fats. So we want to stick to plant-based fats, fish-based fats, ideally, as much as possible. We want to get some
poly and monounsaturated is the term you're looking for.
Yeah. So you're thinking avocado oil, olive oil, omega-3. Those are the catchphrase ones right now, I think. In terms of saturated fats, those are kind of the middle grade fats. We need some, we don't want too much. They come from animals generally, so meat and dairy. From a meat perspective, we're going to try to choose leanest cuts available, trimming visible fat. If in my ideal fantasy world, I usually say is I recommend organic meat. Same with dairy. From a dairy perspective, you want to go kind of middle grade fat. You don't want 0% milk fat yogurt. You don't want skim milk. You just want to kind of stick to the middle. There's some good fat in dairy that we want in there, which we know that supports fertility in general. And then keep the junk to a minimum. You know, we're all going to have a few treats right now, but you know, stick to grandma's rules, right? You have your treats and then you eat real food the rest of the time.
Yeah. I usually, my take homes from this one are, you know, grain is one and done, right? So you can have a grain per day, but, you know, put it into a pot and boil it. So nothing made from flour, ideally, right? Way easier said than done. And then this kind of turns the wheel to forcing people to focus on plants for carbohydrates. So plants first, prioritize plants like as much as you can, because this is where the micronutrients lie, all the carotenoids, all the particular types of fibers that are going to change the microbiome in your GI tract, and, you know, the folate and the micronutrients. As an aside, when you do this, you control your insulin levels and everyone gets regular signaling for growth patterns, right? Both your muscles and your eggs. So I think that that's critically important. Yeah. So this is like a cheat sheet. If anybody wants that particular handout, we have that. And we have it done in different caloric values because obviously different size humans need different amounts of fuels. So we're happy to send that out if anybody wants to follow up with us, and we can give you your own meal plan with your own caloric value and show you what it looks like in food over a course of a few days, because that can be helpful.
Yeah. Okay, so I've noticed a few questions pop up. So Katie, I'm going to jump on some of those, and if I've missed any, let me know, okay?
Yeah. So thanks so much, guys. That was great. This is the chance to get some of your burning questions answered. So there's a couple that popped up in the comments. If anyone else has any questions, just write them in the comments. I'm checking them out, and we've got about 10, 15 minutes. We can ask the NDs. So the first one that popped up, we also got a similar question through email. She says, "Hi, Dr. Fitzgerald. I'm 40 years old and I just became a mom. Congratulations."
Congrats.
What can I do to increase my chances for having second baby besides healthy lifestyle? Any particular supplements? P.S. I'm exclusively breastfeeding.
Okay, so first of all, congratulations on becoming a new mom. So second of all, in terms of what to do to prepare for number two. So whenever I have anybody that's been pregnant and breastfeeding, hopefully they're taking They're a good quality prenatal vitamin. They're omega-3 with vitamin D. And those are the basic ones that I'm going to keep you on, and usually some extra vitamin D throughout that period of lactation. So your body will not start to ovulate or even think about having another baby really until you finish breastfeeding, or until your body starts menstruating again, which is usually a few months after delivery if you're not breastfeeding. But if you're exclusively breastfeeding, we have to consider that any supplement that you take will be potentially transferred to the baby. So we got to be a little bit careful. Yeah. Especially some of the ones that are more stimulating, like coenzyme Q10, which can create sleep disturbances sometimes in the infant. So usually I recommend continuing for at least the minimum 6-month period of exclusively breastfeeding with your multivitamin or your prenatal multivitamin and your omega-3 and extra vitamin D. Maintaining your good healthy diet, like we just talked about. It's about maintaining blood sugar control, having adequate protein, and having a good plant foundation in your diet. And then I don't usually start any type of egg quality supplement until the baby has started to consume some food and we're not exclusively breastfeeding anymore.
Yeah, I agree.
Yeah.
Yeah.
Okay. And sleep, mama, sleep. You need that.
Yeah, for sure. I agree, continuing to take your prenatal vitamin D. Fish oil is a big one, or essential fatty acids. Average woman's brain shrinks 8% per pregnancy if she doesn't take some sort of essential fatty acid. And it's tied with, postpartum depression and things like that. So definitely continuing those throughout lactation is critical, but we can't really start with higher dose antioxidants and things like that for oocyte quality until you're finished breastfeeding. And the return of your menstrual cycle and regular ovulatory patterns doesn't happen until you're finished nursing the baby. I think that's, a protective mechanism so that women don't have babies too close together and become depleted, So there are definitely things that we can do, like diet and basic prenatals and stuff, but I probably wouldn't get into egg quality stuff until you're finished nursing or breastfeeding that beautiful baby that you have at home.
All right. So here is the next question. I think it's a burning question, probably everybody's has on their minds. So has there been any word on when and if Trio will reopen?
Oh, yeah, that is the burning question, isn't it? Trio will definitely reopen, everybody. Trio is going to reopen. We do not know exactly when. We're watching everything right now. We are in contact with Trio on the reg a couple times a week. Trio's executives are meeting daily to try to create this plan. So not only about when they're going to reopen, but how they're going to reopen. So the ultimate goal is, when can we open safely and how do we protect our patients and our staff? Yeah. So I'm gonna guess it's gonna be probably a month or so, but I don't know. I don't know.
I mean, realistically, if you look at what's happening globally, I think that you're going to see the reopening is going to be region dependent, depending on their particular COVID situation. Looking to the US, some of their clinics are talking about opening. And I think as Jen said, the big conversation is that we're not just, the floodgates aren't going to be turned on again. The days of 200 people in a packed waiting room for monitoring in the morning are over. So, we're going to have to change the clinical model, how we see the patients, when we see the patients, and how that's distributed over the workday, so that we consciously reduce the contact. And it's going to be like that for a while. But I want everybody to feel really reassured that we are absolutely, and Trio is absolutely working towards safe steps that are within the guidelines to reopen when it's safe to do so, and that we feel that that's gonna happen within the next few months.
All right. Next question. is how can people, well, there's a lot of interest in getting that diet sheet. So if anyone wants that diet sheet, how can they get it?
Happy to send it to you. I am like the food police, so you call me and I'll send it to you.
You can send us a Facebook message, private message, send us an email at info@conceivehealth.com. Send, if you have our emails or Facebooks, just reach out. We will send it to you regardless of how you reach out to us.
Yeah, we have one for males too. So I give both out whether they ask for it or not. And different caloric ranges. So just give us a shout and we'll be happy to share those resources with you.
All right, we've got a bunch of more questions coming up now.
Great.
This one's long, but I think it's a good question because I think everyone kind of thinks along these lines. Do you suggest taking dairy, carbs, and soya out of my diet? I don't eat meat very much, but eat fish. Is that okay? What vitamins do you recommend? Also, what diet should I follow as my BMI is not great? I've taken melatonin, doesn't help me, and my sleep is bad. Any recommendations? So, I mean, this speaks to just kind of trying to break it down to one question. I think this speaks to information overload out there. I mean, there's so many things even I've heard about, you know, don't eat carbs, let's remove dairy, inflammation, soya. I touched on that a bit, but maybe it's a good chance to speak to those things specifically.
Okay, so let's address the first piece of the question, which was she's taken out soy, dairy,
And carbs.
All carbs. Okay, so first of all, let's break that down. So soy is a protein. It's a complete plant-based protein. There are some good health effects to soy, but soy, North American soy, is often quite genetically modified and very, very processed and can be quite difficult to digest. So if you look at the protein spectrum in soy, there's about 5 or 6 allergenic different proteins in soy versus in dairy, there's only 2. So a lot of people find soy is very difficult to digest. That being said, soy can also have an effect on the thyroid function and is typically not really recommended for patients that have endometriosis, for example. So I would say, things like edamame beans that aren't processed and stuff, I'm cool with that.
Or miso, I like miso.
So, that's like it's a soybean paste that's been fermented that you can make a soup out of. I'm a fan of that as an electrolyte replacement and actually often recommend that. But, chugging back, soy milk or eating like tofurkey and these replacement sort of synthetic meats in lieu of actual, animal-based protein, I would probably reduce that.
It shouldn't be a main source of protein all the time. Like if you have a bit of soy, like soy latte here and there, or you have edamame,
no big deal,
once a week, or stuff like that, I'm fine with soy. But if you have soy milk lattes and then you have tofu stir fry for lunch and then edamame for dinner, like way too much soy. So don't do that.
So I think it's dose dependent. Dairy's a really loaded conversation. We're the only species on the planet that drinks another species' milk. It's weird, right? So I think the bigger thing, I'm a podcast addict, and so I have been listening to different doctors and stuff. There's a decent amount of evidence that shows that high dairy consumption isn't great for fertility, both men and female. And I don't think it's necessarily, is it chemicals in the dairy? Nah. It's the hormones that's in the dairy. Cows produce a lot more hormones than humans do, and then we drink their milk, and that goes into our system. Not good for us, right? So
and you could say the same about a lot of other health conditions with dairy too. Like it's a bit inflammatory. There's different proteins in it that our body doesn't digest so well. Some of us are actually intolerant or allergic to.
Me, right? I don't have the gene.
Yeah.
So, and you know what, I was reading a microbiome paper the other day that said that women that have PCOS actually have microbiomes, which is the GI sort of bacteria that predispose them to lactose intolerance. So it's extra inflammatory for those particular patients. So dairy is a Goldilocks thing. I like it because it's a quick and easy protein and it's got preformed, levels of vitamin A in it. But I always say, less is more with the dairy, to be perfectly honest.
If you're going to have dairy, the best source is organic Greek yogurt that's plain.
Yeah.
And it has still dairy fat in it. If you're
like,
going to have dairy, that's the best option.
Yeah. Or like feta cheese or goat cheese. Those ones would be good options. The proteins are a little bit smaller and easier to digest, and you're still getting that complete protein and the vitamin A. So, when someone's telling me that they're craving milk and craving cheese, I usually go into their diet and look and to discover that they're protein deficient. And the reason they're craving the dairy in the first place is because it's quick and easy protein, right? Like a glass of milk is 10 grams of protein down the hatcheroo. And if she's dependent or he's dependent on that, it's typically because they're not feeding themselves properly with real food earlier in the day. And then the carbohydrates.
So what was the rest of the question? There was carbs.
Yeah.
I think carbs.
So you absolutely need carbohydrates, right? It's just what form do they come in, right? And so is it grain-based carbohydrates or is it plant-based carbohydrates? So oftentimes I'll do the 4-week flourless challenge, especially with my patients that have an escalated BMI. And so the minute you take out flour and say, oh, I don't eat carbs that are made from flour, it immediately eliminates most processed foods and things that are going to spike your insulin really quickly. And so it steers you into the beans and legumes, the root vegetables, and garden vegetables and fruit. That's where we should be really focusing our carbohydrate intake on, right?
All right, so we've got, we'll move on to another question here. This one's interesting. Do you have any dietary, supplemental, or other recommendations for adenomyosis?
I would follow the same types of recommendations for endometriosis for that specific pathology. So we're talking about things like increased plant-based foods, cruciferous vegetables, like Dr. Malone mentioned earlier. So think kale and Brussels sprouts and broccoli and cauliflower and those types of things.
If it's really
not a lot of red meat,
consider a supplement.
Pardon me, sorry?
If it's really severe, I would consider a supplement that has a higher dose of that particular plant-based agent in it, indole-3 carbinol or DIM.
Yeah, absolutely. Yeah.
I would probably do like a lining protocol as well if she's got adenomyosis that helps improve the vascular flow of blood to the endometrial lining and some of the capillary beds, Jen.
Yeah, I always think of things like omega-3, vitamin D, resveratrol. Those are the things that come to mind. But again, you should consult with a professional before you start widely dosing yourself with agents.
And here's one. Is there a specific form of folate you recommend? Is basic folic acid adequate?
Well, that really depends, and it depends on our genetics, and we don't always have that information. So if we don't know, the answer is use active folate, which is can be called L-methylfolate. It can be called methyl tetrahydrofolate. There's a bunch of different terms for it that you'll see on a prenatal label or on a folic acid label. But simple folic acid requires us to be able to break it down. And if we don't have the genes available to do that, then we simply don't get a lot of folic acid from our folic acid supplement. So if we are recommending supplements to a patient, we always use activated folic acid. I never use regular. And certainly if we know that there's a genetic tendency, then we absolutely recommend activated folic acid. Does that answer the question? I don't use regular folic acid.
I don't use regular folic acid either. I presume that the genetic vulnerability to folate metabolism is higher in the infertility population. And so because that's exclusively my patient population, I would only and ever prescribe a prenatal that has methylated tetrahydrofolate. And you only need 1 milligram. One and done, right? Because that old recommendation of 5 milligrams of folic acid is way too much. The research shows that, but the memo got lost in the mail. People still take it in high doses. Mm-hmm.
All right, we've got another one here. IUD removed November 2019. Waiting for cycle to improve. How do I get my ovulation on track?
All right, that's a great question.
Mm-hmm.
So there's two different types of IUDs. So there is the old school copper IUD, which really just aggravates the uterus so that there's no implantation. What I think you're describing there is something called the Mirena. So that's a hormonally active IUD that secretes hormone while in utero. And so once it's removed, it can take a period of time for the ovulation hormones to kick back in. So there's a few plant-based agents that I would particularly use in this case. One of the most tried and true is one called Vitex, and so it is a plant-based agent that affects the pituitary function, FSH and LH release, and tends to even out the ovulatory signals that come from your pituitary gland. But I think, you know, it's equally as important is to ask that patient, why did she get the IUD in the first place? Was it for contraception, or potentially was she doing it to mitigate irregular and painful periods? If that was the case, you need a little bit more patient history in order to understand if there was a pathology there prior to putting the IUD in. If there was not, then it shouldn't be that difficult to get the ovulation started and kick-started again. Be happy to talk to you about it.
Mm-hmm. Yeah, in time it will come, but we can speed it up generally. Yeah.
So here's another one. I've already had my egg retrieval and still have 5 frozen embryos. After 2 failed embryo transfers, I have 2 questions. 1, should I continue taking CoQ10 and melatonin to improve egg quality? 2, is there anything I can do to make my uterus more hospitable to an embryo?
Ooh, those are great questions.
You go for that. Jen's the lining queen. She's got it.
Okay, well, so the first question, should I continue CoQ10 and melatonin for egg quality? My answer, I'm sometimes brutally honest, and I apologize. If there's ever a possibility of another egg retrieval on the back burner, stay on the CoQ10 and melatonin. I would say at least a half dose of it in terms of the CoQ10. Melatonin you can use to support your uterine lining, which I'll talk about again in a second. But if there's ever a possibility that you're going to go in and try to get more of your eggs, I would stay on some level of CoQ10.
Yeah.
Okay. So moving on to lining support. Yes. So, you know, we do lots of lining function tests in the clinics. You might have heard of a few of them kicking around. They measure the thickness, they measure the pattern, they sometimes look at something called compaction, or there's some fancy testing sometimes that they'll do. But at the end of the day, they're looking at receptivity, right? So we know that there's a lot of things that can affect receptivity, and that is dependent on our hormone levels, or, you know, sometimes our stress levels, and everything that we talked about so far: insulin resistance, inflammation, nutrient status, all of those things. So we start with taking some basic nutrients. So we need vitamin D, for example, to grow a good lining and to grow proper hormone receptors in that lining. We want to make sure that we're in generally good health. So our general health is going to reflect egg quality and the internal health of our uterus. So if you're, you know, lots of inflammation in the body or something like that, we have to assume that, you know, the lining can be exacerbated that as well. So I'm thinking, I always consider the basic supplements in terms of frozen embryo transfers to be your prenatal vitamin with proper folic acid, which is the active folic acid we just mentioned. I always do omega-3 with vitamin D. I consider things like vitamin E for blood flow support and for thickness. I might consider probiotics or things that support the microbiome. So this is kind of a newer area that we don't hear a lot about, but the kind of internal microbes that live in our uterus basically kind of dictate how the little immune system in the uterus are working, right? So if the uterine lining is growing and we see it thickening and the pattern is there and there's no inflammation and all of these things are happening, then what's going on? And so when we're looking at that microscopic environment, we're talking about things like what bacteria are there are not there in the right quantities, and how can we influence that? And that in turn influences immune system, blood flow support, all of those things. So eating plant-based foods to get that prebiotic fiber, taking probiotics can be helpful sometimes. I think prebiotic foods too, in the terms of things like fermented foods, there's kind of a whole category of foods that we call the fermented foods. Miso, we mentioned earlier as well. So those types of foods, although we don't think about them specifically in terms of our uterine lining, actually help to create that kind of foundation that we need for the lining to function properly. The melatonin, going back to the melatonin briefly, antioxidant, there's lots of evidence in terms of melatonin actually being one of these early implantation factors that helps to prepare the lining for implantation itself. So I do think it's valid to continue the melatonin. Did I miss anything, Malone? I was rambling.
No, I think you're doing a good job. I think the take home is that, overall, the fertility community is really starting to pay a lot closer attention to the gestational environment and the lining for frozen embryo transfers. It's sort of the third thing that we have to control for. We control for the egg quality, sperm quality, and then the last thing to control for is the endometrial receptivity. So, thickness is one thing, but functionality and receptivity is another. And so there's a lot of different things that we can look at, including nutrient status, microbiome, that can dramatically impact, the quality of your lining. So that would be something I would, it's very individual depending on the case. And so that is something where I'd have a professional evaluate your case and make you a protocol for that.
Okay, so we've got time, I think, for one or two more. So we'll go, I think this is a good one here. I have stage 4 endometriosis and was supposed to have my IVF journey start in April. I'm going back on a month Lupron shot today until we know what the future will look like to keep my endometriosis from spiking back up in full force.
Yeah.
What else can I do to prepare my body and endometriosis to have a successful IVF baby? Currently taking vitamin D and prenatal.
Okay. So endometriosis is a fairly common condition. It can be debilitating for some women because, as you know, it's graded from 1 through 4. So grade 3 to 4 would be the most significant sort of manifestations of those. And as a repercussion, endometriosis, we consider it to be an inflammatory type of condition. So first of all, she may make more of the stronger type of estrogen, and B, she may have trouble detoxifying this. And as a result, we have a higher level of inflammation when the endometrial lesions shed each month because they bleed directly into the pelvic cavity versus being contained in the uterus. And so this can create a higher level of oxidative stress because of the proximity to the ovaries. And so for a patient that has endometriosis, it's a two-pronged type of support system. So first of all, I 150% agree with the Lupron. It's, I know it's no lightweight of a drug, it really suppresses your hormonal levels and it can give you a hell of a lot of side effects. But it is the best way to reduce and control the oxidative stress that would be, you'd be exposing your future cohort of eggs to. So for sure, take the Lupron. Normally, when I have a patient doing a short or a long Lupron protocol, which is typical before they do an IVF cycle, if they have endometriosis, I would combine that with a higher level of antioxidants, as well as ensure that our detoxification systems are working very swiftly and well. And that would be the preparation leading up to when you actually come into the clinic to do your injections and your IVF cycle. The impact of environment in an endometriosis case prior to the IVF cycle, in my opinion, is imperative to get the amount and the quality of the eggs that we're looking for when we actually go to do your retrieval. So, you know, to encapsulate, you know, endo patients, we do typically, it's a gluten and dairy reduced diet. It's, you know, I would call it probably pesco ovo style vegetarian type plant-based diet. And then I would use a handful of antioxidants to target their oxidative stress parameters prior to their IVF cycle.
Mm-hmm. My favorite antioxidants would probably be N-acetylcysteine or resveratrol.
Resveratrol, yeah. Resveratrol is an unsung hero in endometriosis. And so definitely resveratrol is the plant pigment, the phytochemical that, you know, gives red wine its claim to fame for being healthy, right? And that's why I keep drinking it. But realistically, you know, it can be found in other plants too, like Japanese knotweed and certain other plants. And it's concentrated in a small gel capsule. The key thing to remember about a good quality resveratrol is the dosage range would be about 120 milligrams a day. So it doesn't take that much, but it has to be in a soft gel because it's tricky to absorb. It's fat soluble, just like CoQ10. So normally I would give it in a soft gel and have the patient consume it with healthy dietary fat because that's how it's going to be absorbed.
All right. I have unexplained infertility with low AMH, and I'm worried about this time off and how it will affect my egg count. Is there anything besides diet, exercise, etc., to increase my chance of a successful pregnancy while I'm waiting to meet for IVF consultation?
Yeah, so always a really stressful position to be in when we feel like we have low count and we have to be waiting, but try to focus on quality over quantity, right? And so really the key here is to support the follicles that you have. There are some papers out there suggesting that certain nutrient deficiencies, for example, can influence things like AMH. So vitamin D, for example, if we have low vitamin D, it can sometimes create lower AMH, sorry. And so by correcting vitamin D levels, we might see a slight increase in AMH. So there are a few things like that. So vitamin D supplementation, every fertility patient should really be on. But I would focus on supporting the quality of those specific follicles that we know are in there. So things like maybe coenzyme Q10, PQQ would be important. N-acetylcysteine I would consider. So some of those in kind of higher doses. So you'd be thinking for CoQ10, for example, around 600 to 800 milligrams is where I'd be sitting with that.
Yeah. And, you know, like I think when you have, you know, the hormonal profile that gives you that designation of, you know, low ovarian reserve or diminished ovarian reserve, we know for sure, we see you, we hear you, and we feel you. It creates panic in women.
Yeah, totally.
But please recognize that the majority of you that get that information are still menstruating and still ovulating. So I think sometimes context changes choices. And if we know that our window is shorter than we thought, then it's time to get slightly more aggressive with the treatment and not wait. So you being at home, you know, there again, you know, moving beyond antioxidants, there are plant-based agents that can absolutely encourage a better hormonal milieu that affects both quantity and quality, right? And so most of my patients that have decreased ovarian reserve, not only are we working at quality, but we're working at the overall hormonal cascades that can improve quantity 2 to 3 months down the road as well, right? And you got to remember, it only takes one, right? And so if you're still ovulating, I always say never miss a cycle, right? And so try to get a professional consultation so that you have the right agents in play for your particular case.
And so this will be the last one. It is a question, and also someone liked it, so I think two people have this question. How can stress affect the growth of a fetus, and can it cause any growth issues or miscarriage? So that's a timely question given where we're at right now in the world.
Yeah, fair question. I mean, you would have to be under pretty significant stress to cause any harm to your baby, right? Like, we're talking real serious trauma. That baby is really protected in there. It's, I think the most detrimental thing from stress would be the interruption of blood flow to like certain places potentially as your body's trying to kind of go into fight or flight mode. So I think the best thing to do is just, practice your relaxation exercises, try to stay calm. Yes, we're all a little bit out of sorts right now. Some of us more than others. Some people have lost jobs and finances are really struggling right now and things like that. So like, valid stress, absolutely. But I mean, we have to do the best that we can to try to allow our body to recognize the stress, but not take us down in the meantime, right? So implementing some of those self-care strategies so that we can manage the stress is the key. We can't always remove the stress, so we have to live through it. It's just about managing it. And there's different types of stress. I say there's positive stress that, deadlines and things like that we put on ourselves to get stuff done, versus negative stress that are going to be things that are more detrimental to your health. Anything to add to that, Malone?
Yeah, my first degree was a psych degree. And so what we focused on was how to change your behavior so that affects your physiology. That was my thesis, and that's what we did it on. And so we learned that by taking yourself through a series of, whether it be relaxation responses, exercises, or consciously augmenting your breath patterns, you can actually reduce your heart rate, reduce your cortisol output, and vasodilate yourself. So just as Jen said, we can't escape all the stressors. Like, we're in the middle of a pandemic that we will likely, hopefully never see again in our lifetime. But, the reality remains that babies are born in times of war and times of panic. And, we are magnificent pieces of machinery. Make no mistake, ladies, like, our physiology is so complicated, it was mind blowing. But, if you notice that you are anxious and sweating and cold and not eating properly, please address the things that you can control. And, I don't really think that anything that you're doing at home is going to put you in a compromising position during your pregnancy. It's what you're going to be doing outside your home. So stay home until we get this thing under control, I think, is the big thing. The best thing that you can do to help your pregnancy progress is eat healthy food, get good sleep, take your prenatal routine, and don't get COVID, right? Like, that's the big, thing. You got to stay home and wash your hands and protect yourself from a very, very transmissible virus, right? And so the best thing you can do is, listen to public health officials and take the direction that's been given to the rest of the public, and use the social isolation precautions for yourself, for sure. If though none of that is working for you, then please reach out to us, because we have a wonderful team of psychological experts that deal specifically with fertility patients here at Trio. And I know that they would be happy to talk to you.
Absolutely, especially this week, because it's Infertility Awareness Week, as you probably know. But I find there's a lot of messaging right now. Everybody's posting about it, and sometimes it's good to see the uplifting messages, and sometimes it's a constant reminder of what you're dealing with. So by all means, the counselors that work with the Trio patients are hands down the best. So by all means, if we can't help, we will put you in touch with the people that can.
Mm-hmm. Mm-hmm. Yeah. And like, if she can't settle down, then we can straight up sort of sedate her central nervous system with safe plants. I've done that in the past too, right? You know, fertility patients are some of the most vulnerable and some of the most stressed patients you will ever see in a medical practice. And, you know, as much as I want to talk about meditation and lifestyle techniques to downregulate your fight or flight response, sometimes you just need a little help, and that's okay, right? But there's some things that are safe and some things that are not safe. So you can talk to us about that.
Or anybody else on our team as well. We've got a great team.
Yeah, we are here for you ladies. I feel just wide-eyed about what's actually happening right now in the world, and I can extrapolate by my patients' comments and what I'm hearing around the clinic of just how stressed people are, but particularly fertility patients right now when they have blocked access to care. But we'll be returning to you soon. I believe that our clinic will be opening, and you'll be the first to know when we have those strategies in place.
Mm-hmm. And in the meantime, we're available virtually. So if you need to talk to somebody, if you want to have a full consultation with one of us, we're available for virtual consultations. Just reach out via email or Facebook, whatever the case may be, and we will set you up with that.
Yeah, and patients, you know, we do have access with your consent, of course, to your chart at Trio, because we have a unique sort of integrative model. So we do have access to all of your, you know, objectives and things like that with consent. And the other big question that a lot of people have been asking us is how do they access these agents? And so there's a number of different options for patients to have you know, fertility supplements delivered, or they can order them online so that you're not having to like shop around in the public right now. So we've kind of got the virtual system down now, and those things can be delivered to your house if it's necessary. Okay.
All right. Thank you guys so much. Thanks everyone for your questions and the engagement. And I really hope that, you know, we help to inspire and provide some hope and help to everyone out there. And thank you so much, Trio, for letting us take over your Facebook today.
Yeah.
And,
thanks, Trio. We miss you.
I can't wait to see the team. I never thought I'd say it, but I can't wait to come in at 7 a.m. some morning and see all the nurses.
Yeah, I didn't think I would miss waking up in the dark and hustling it downtown, but I sincerely do. I miss our patients a lot more than I thought I would, and the entire staff. I really do. But stay home.
Yeah, but stay home until we're ready. Yeah. And listen, ladies and gents, if there are any other questions or topics or things that you want to know about, we're happy to do this again, either on Trio's page or on our page. So send us a message or send us a question, and we'd be happy to reach out to you or expand on any particular topic that you're interested in.
Awesome. Okay, we're gonna go off live here now. So thanks again, everyone. Thanks so much, Tracy and Jen. You guys, I love these.
Bye.
Bye, Katie. Thank you so much. Thanks for joining.